the oxygen advantage, I put an emphasis on functional breathing training just as much as I do on stressors. So in terms of we have breathing exercises to downregulate, to bring people from a sympathetic tone into a parasympathetic tone, I want to know how is the person breathing during rest, during sleep, during physical exercise. I'm not just concerned about how are they breathing when they're inside the studio. More important is how are they breathing outside of the studio. Because you can influence the autonomic nervous system. Just even looking at functional breathing, we need to look at it from a perspective of three dimensions: the biochemistry, the biomechanics, and the cadence of the breath. And every time that we look at breathing, I always will look at it from those three dimensions. A breathing technique, what's it doing to the biochemistry? Is it increasing CO2? Is it reducing CO2 in the blood, or is it keeping the same? The biomechanics, is it helping to improve breathing low, having lateral expansion and contraction of the lower ribs? Cadence of the breath, is the breath being slowed down sufficiently down to 5.5 and 6 breaths per minute to stimulate the vagus nerve, to increase the sensitivity of the baroreceptors? So functional breathing is tremendous because this is where we can too make subtle adaptations conducive to improving health, because people who are not well, either emotionally or physically, they have poor heart rate variability, and we can help improve heart rate variability, which is a measure of vagal tone, by changing their functional breathing patterns. Now, on the other hand, with oxygen advantage, we do breath holding, but I don't do the hyperventilating before the breath holds. So we have a normal breath in, a normal breath out, we hold the nose, hold the breath, and then we will combine it with physical exercise. The purpose is to drop blood oxygen saturation and to increase carbon dioxide. And the combined effect here of the hypoxic hypercapnic stimulus is to disturb the blood acid base balance, to force the body to make adaptations, to improve buffering capacity, probably inside the muscle compartment. But also we get spleen contraction, we're reducing the sensitivity towards carbon dioxide, increasing blood flow, open up airways, etc. So that's oxygen advantage, functional breathing and a stressor. Wim Hof technique, of course, is you've got the cold, which is excellent in terms of, putting the human body into a sense of discomfort to, again, force the body to be more resilient, if I use that word. And then with the breathing technique, it's also a stressor. The hyperventilation, the 30 breaths at the start of it, it will get rid of a lot of carbon dioxide, from normal of 40 millimeters of mercury down to, I can't remember what exactly it is. And funny enough, I was only looking at the paper last night. But the first cycle of hyperventilation does get rid of a lot of carbon dioxide from the blood through the lungs. This creates a state of, this increases blood pH. After the hyperventilation, because there is such a depletion of carbon dioxide, the individual can hold their breath for so long, because carbon dioxide is the alarm to breathe. And if you get rid of the alarm to breathe, well, you have to wait for carbon dioxide to accumulate in the blood before it triggers the point whereby the brain sends the stimulus to breathe. So if you hyperventilate and then do a breath hold, it's natural that you will hold your breath for so much longer because the alarm to breathe is being depleted. And as you're able to hold your breath for so much longer, your blood oxygen saturations can go much lower. So with the Wim Hof technique, they achieve a greater drop to blood oxygen saturation than what we do. And their first cycle, it drops it down to 85%. That's what I want to do. That's our goal throughout all of our cycles. But with the Wim Hof technique, after the breath hold, the carbon dioxide that has been reduced, and I can only refer to Cox's paper because it's the only science that I can find, there could be more papers out there, that the carbon dioxide they'll drop the carbon dioxide during the hyperventilation. It doesn't recover during the breath hold. And that's why I would put my stance on it would be that the Wim Hof technique, as according to Cox's paper, is hypoxic, hypocapnic, low O2, low CO2. Now it's the combined effect of that's stressing the body, that you have an increase in epinephrine, you have an increase of adrenaline, and this in turn then the sympathetic activation, that you're putting the body into such a stress state, almost that you're shaking the body to wake up the body, that the immune system then is forced to, would it be to reset or to refocus, but to target. And the interesting thing that the researchers from Theus Cox wrote. He says there are medications on the market for irritable bowel syndrome, for rheumatoid arthritis. And I have met individuals with rheumatoid arthritis who have been able to come off their medication as a result of doing the Wim Hof technique. Now, that's anecdotal, but if you look at and it's not to say that it's not happening. The only reason I'm saying it's anecdotal is and I would totally believe the people who told me about it. And because they were able to give me a description of the drugs that they were on, I think it was Amira. They were able to give me a description of the side effects, the history. And these were young individuals who would have been on a life of this medication for the rest of their life until they came across the Wim Hof technique. The issue with these medications are, number one, is they are very costly. And number two is that they have significant side effects. Significant. Now, these medications are stressing the body, or if I may not be using the words correctly, but they are in a similar way, almost that they are antagonizing the immune system to be better able to cope or to reduce, to fight the inflammation. So that's the point that Cox made. Now, could you have a breathing technique that is literally free once you learn it, that can offer this prospect, this potential for many people with serious medical conditions, including rheumatoid arthritis? And it just doesn't make sense that we are not putting more research into it, on the basis of that. And so to make a comparison, I think the Wim Hof technique and the oxygen advantage actually have good similarities, but it's the breath holding. We don't do the hyperventilation. We do breath holding. We do breath holding also on the exhalation. And then we look at functional breathing patterns as well. Now, the result, you could ask the question then, does the Wim Hof technique increase or decrease oxygen delivery to the tissues? And that's an interesting one. From the oxygen advantage point of view, when you do a breath hold, carbon dioxide is intact. And during that breath hold, carbon dioxide is increasing and it will cause vasodilation. So, for example, we can improve blood flow to the brain despite holding the breath. But if you hyperventilate as during the Wim Hof technique, you've blown off a lot of carbon dioxide. Even during the breath hold, carbon dioxide is not fully recovering. What effect is this having on blood flow? Probably, is it causing vasodilation? Not likely when CO2 is not recovering back to baseline. The second aspect is if you hyperventilate, you don't increase the blood oxygen saturation. Because normally, with normal breathing, we are already almost fully saturated, 95 to 99%. Now, if you, for example, have an individual and their pulse oximetry, which is a little finger probe you put on your finger, and it's measuring the fraction of your hemoglobin, your red blood cells occupied by oxygen. If you have, say, a blood oxygen saturation, an SpO2 of 97%, if you hyperventilate and you get rid of carbon dioxide, your blood oxygen saturation will actually increase. And the reason being is because the affinity of hemoglobin for oxygen has become stronger. And hemoglobin isn't releasing the oxygen so readily to the tissues. So what hyperventilation does in the depletion of carbon dioxide is that less oxygen actually gets delivered to the tissues. So on one hand, during the Wim Hof technique, you're going to have a left shift of the oxyhemoglobin dissociation curve as a result of the loss of carbon dioxide and the drop to blood pH. But on the other hand, the hyperventilation is going to increase the oxygen dissolved in the plasma. So there is a small amount of oxygen carried directly in the blood. So here, on one hand, you have a net loss of oxygen delivery. And on the other hand, you have a plus. So what's the overall effect? I don't know. And that's the interesting thing about it, And this is the thing about breathing. And, like sometimes there's more and more as new things are unearthed. Like, for example, nitric oxide, that gas, that was only discovered on the exhale breath of the human being back in 1991. And of course, that's going to change the dynamic and the theories behind what can be happening when people are doing breathing exercises.